You know, I've noticed over the last 2 or 3 weeks, I've been having a little bit of trouble breathing. And I always tell people, what do you mean by a little bit of trouble breathing? You're a little pregnant? Okay, so you have a little bit of brother. You have trouble breathing, basically. So I've been having that trouble breathing there for a while now, like I said, the last 3 or 4 weeks. And I notice I've been getting more and more short of breath when walking. First, I could walk maybe 200 feet. Now I'm down to 25 feet. I get short of breath. And my ankles, both these bad boys are like cankles. They're like really big, okay? And I just can't breathe well. And I notice when I lay down, when I lay flat in the bed, that's why I'm sitting in this chair here. I go to sleep right here. Because when I go to bed, laying back flat, hell, I can't breathe. Okay? So I wonder what is going on with me. Again, I'm short of breath. I can't breathe. Ankles are swollen. And I cannot walk very far at all without almost passing out. That is called congestive heart failure symptoms. It needs to be checked out, right? That means you need to see a cardiologist. Echocardiogram, which is a special thing to check the structure of your heart, needs to be done. Yeah, EKGs are important too, but an echo in this case is critical to do. Also, salt. A lot of us get congestive heart failure because we have too much salt in our bodies, which I'm sure Dr. Lewis will talk about the salt intake as well as one of the major contributors to congestive heart failure. And of course, there's all other kind of issues too. If you're overweight, you're going to be most prone to have congestive heart failure. If you have any kind of vascular type disease, you're probably going to be more prone to have congestive heart failure. The other thing about congestive heart failure too is that you'll find yourself with a decreased appetite. You'll find yourself, unfortunately, drinking more water than what you should. Because remember, now, you're not getting rid of the water anyways. So the more water you drink, the worse the symptoms really would get. Okay? So that's the story behind congestive heart failure. So it's not a big dramatic thing here with congestive heart failure, like the other things that I've illustrated to my little sketches, I call it. But this is something that's very serious. Congestive heart failure is extremely serious because we know that once you get diagnosed with congestive heart failure, your chances of surviving 5 years get smaller and smaller. We're talking about maybe 35% of the people that's diagnosed 5 years prior will have died by the time they hit 5 years. So it's a serious disease. It can be treated. They have all kind of great medications out there, and I'm sure that Dr. Lewis can talk about those things. But our job is to make sure that you understand the signs and the symptoms, the early signs and symptoms. That's going to be what? Shortness of breath, difficulty breathing, swelling up of your legs, sometimes all the way up to here where we press down on it, and there's a big indentation there. We call it pitting edema. Not a good sign, right? So, and again, walking, you'll find you could maybe walk for maybe 150, 200 feet, no problem. But all of a sudden now, with the last couple of weeks, like I said, I can't walk no more than 25, 30 feet. Get short of breath, okay? So that's the takeaway on that. Bing.